That's right. It's a nice day outside to be rolling with Ruby.
Yes.
Sun's shining. It's finally stopped raining. That's a good day. So Cindy and I were on the road Tuesday, and we were headed to a client's house. She is getting ready to have a joint replacement, knee specifically. But we're going to talk today kind of generally more about getting ready for joint replacement. Now, Cindy, what has your experience been like? So Cindy's a physical therapist, I'm a speech therapist, we're rehabilitation therapists. And what has been your experience, especially because Cindy's been in home health the majority of her career.
Right.
What's been your experience about people who are having a joint replacement, like a knee or a hip, and getting prepared
Yes.
to go into surgery before the surgery?
Right.
What's been your experience?
My experience is that people aren't as prepared as they think they are, and they end up being surprised when they get home.
Yeah.
Especially that first night, little rough.
Yeah.
Because you're dealing with coming out of surgery, you're dealing with some discomfort, and then maybe you realize that you can't get off the toilet, or you can't get out of your comfy chair, or your bed is too high to get into.
Yeah.
So
we always encourage people to be proactive. Now, I think as humans, that's not typically us.
Right.
It's just, for what, not bad, not good, it's just not typically who we are. So we ran into a client the other day who was proactive.
Yes.
She was not going, she was probably, a couple weeks out or more?
Yeah.
So is that ideal? What would be the time frame? So if somebody in our audience is considering a joint replacement, what would be the good time frame to actually go through the house and decide, this maybe needs to change, or I need to borrow this piece of equipment to get my house ready prior to me going to have surgery?
Right. I would do it at least a couple of weeks prior, just so that you know, because you may have to find somebody to borrow this stuff from, find a lending closet, or get some things from family members. So I would start a couple of weeks before, 2 or 3 weeks before. But also just be prepared too in thinking about maybe asking the doctor for a visit to a physical therapist. A lot of doctors, well, I say a lot, I don't know, some do, some don't, but they do prehab. Which means that they want you to go and do some specific exercises prior to your surgery, because the better mobility and the better strength that you have going into surgery, the better it will be coming out.
So let me ask you guys, I want to ask the audience, having talked about prehab, if you have had a joint replacement surgery, let us know in the comments. Did you have prehab or not? I think it'd be interesting to know, is that common? Or
it used to be, or there was a time frame that there was. It hasn't always been. There was a time frame there was, and then it was like it dropped off. So I'd be interested in knowing. I know a lot of people go to like a preparation class. But it usually is, maybe a week, maybe 2 weeks prior to.
And it's not very long.
It's usually the class
is maybe an hour or so.
An hour long, and they just kind of tell you, oh, you need this, that, and the other. And
most of the time they encourage you to bring your caregiver with you, the person that's going to be caring for you, to go to the class. And what we have found is that, you go and you sit through the class, and when at the end they say, does anybody have any questions? You can't think of any, but it's not until you actually get home, and then maybe start going through your house and applying what they've said, where then you have questions. So that's kind of where Adaptive Equipment and Caregiving Corner comes in. So we've got a series of videos that we sell subscription to. Our library has over 200 videos, and we have a couple of series that address getting ready for knee replacement, total knee replacement, and total hip replacement. So if you're one of those people that falls in that area where you've gone to the classes, you've talked to your surgeon, you're getting ready, but you're just not, or you got these questions, check out our aecorner.com. Get a subscription, get ready for your knee surgery, and then whenever you're done, you can cancel. It's like $10 a month. You can cancel when you're done. So so anyway, So we were talking about prehab
Uh-huh.
and also the class that you take with your caregiver.
Right.
And the millions of questions that you have when you get done.
That's right. That's right.
So anyway, back to the client that we were going to. She was being proactive, and I mean, I'll tell you what, it felt like Christmas. We were going out there. We had so much stuff. Now, Cindy, you had talked to her on the phone earlier,
Right.
So we had a feel for what we needed to take. So it wasn't just this random. And I know sometimes people will go and either buy this equipment they think they might need,
Right.
but they don't know for sure,
Right.
or they will, borrow equipment that they might not. If you buy it, then you have it, right?
And you spent that money.
Yeah. So we would encourage you to, go to find a lending closet that will let you borrow, especially for knee replacement or joint replacement, hip replacement.
Right.
You're not going to need it forever. You just need it to get you through while you're recovering and stuff.
Yeah.
So
you want to go through just some of the more common things that I would recommend just prior to a joint, a hip or knee surgery?
So I think it would be helpful if that's what we did, because this woman that we spoke to, she had the luxury of being referred to us.
Right.
And then we were able to talk to her ahead of time. So so let's start with the three big areas that we think you need to check in your house.
Right.
And to make a successful recovery when you get back from surgery.
Yeah, so first thing I'm going to say is the toilet height.
Yeah.
Because even if you're having an easy time getting up now, have you ever tried getting off the toilet standing up on one leg? Because you think about, you're going to have some discomfort, you're not going to be especially, well, if it's a knee or a hip, you're not going to want to bend too much in the knee or the hip initially. So if you have a low toilet or you have any weakness in your other leg, don't overestimate your ability to stand up with one leg. Especially if you don't have a good solid hand push off. And if your toilet's low, you're probably gonna struggle.
I don't have, my knees aren't bad yet. I'll be 60 at the end of this year, and the muscle loss that I have felt. I mean, we exercise every day, and try to keep, stay active and try to decrease that muscle mass loss. But I mean, I can feel it. I started feeling it when I was probably in my mid-50s. Early to mid-50s, where I'm like, wow, just standing up from the floor is kind of hard. Or getting up from the toilet, you're just like, okay, I got a little bit of weakness in my quads. Now add on top of that, surgery, and you've got that
all the weight on the one leg.
That's right. That's right.
So definitely some type of a toilet riser with handles. I always recommend handles. People try to push off the sink, and sinks can be too high for good leverage, and when you're struggling, you need a decent push off. So I always recommend a toilet riser with handles. You can also put a bedside commode frame over a toilet. It adjusts in height. It has the handles.
It's called a 3-in-1. Usually a bedside commode, people think of it when it's just bedside commode, right? But they also call it a 3-in-1 because not only does it work at bedside, but you could take the frame and put it on. It's perfect for the toilet. It comes with a little splash guard sleeve, and I mean, it's made to do that. But I don't think people think outside the box.
And if you have a caregiver with you, you could use that during the day over the toilet, and then have them remove it and take it to the bedside at night for a little while if you need it that way. Now, if you are going to be more so, on your own, hopefully not, but if you are going to have a little bit more struggle, you may need to look into borrowing both a toilet riser and a bedside commode, or two bedside commodes, one over the toilet, one at the bedside for a little bit.
That's great tips.
But that's one of the biggest things there to start with. And then the other thing is people misjudge their ability to get out of their comfy chair, which a lot of times is a rocker recliner. And when we talked to that lady, that was kind of that same thing. Right. And that can be a struggle, especially with a rocker recliner. We forget that when we scoot forward in those, the seat drops about 2 to 3 inches because it rocks forward. And I've had many people be shocked that they couldn't get out of it after surgery.
And they're so plush and comfy.
That's right.
You sit them and you're ensconced in these big,
Right.
oversized, overstuffed chairs.
Right.
And so trying to get out of them
Right.
can really cause. And then when you add on top of it, if it's a rocker recliner,
Yeah. So we suggest, if you have someone that can build a platform to set that rocker recliner on, to bring it up about 3-4 inches.
We have a video for that, by the way.
Yes, we do have a video for that, or sometimes just kind of as a strategic or a kind of a triage thing is we will block the front frame on both sides of the chair with a couple of pieces of wood or a couple of bricks or something to prevent it from rocking forward, so it won't drop that 2 to 3 inches when you scoot forward in that chair.
Yeah,
just temporarily.
That's such a great life hack or a little quick tip that I'm sure you've done that in your home health career.
Oh yeah,
and it probably just blew people's minds.
Yeah.
You just don't even think about it, because you put those books or bricks or hand weights, we use the hand weight in our video, underneath that frame, and it keeps it from tilting forward. Even just those 2 or 3 inches like that can make all the difference between getting out of your chair and not getting out of your chair.
Yeah, that's right. That's exactly right. And so the third area we talk about is the bed. The bed height is usually quite tall, and it's hard to get on the bed when you have a leg that's hurting, because usually you just bring that leg up, or people crawling forward or something like that.
I've seen that before, people crawling in forward.
And so there's one of two things that people say, oh, well, I'll just sleep in my chair. Well, if you can't get out of your chair, you're not going to sleep in your chair.
Here we are again.
So there's that chair. You got to make sure that is taken care of, number one. Because a lot of people do sleep in their recliners for a little while. But
because it's a nice, especially when you first get home, because you might need to elevate it.
Yes.
And it's a great place to have it elevated and to ice it and everything in that chair and be comfortable and stuff. So
so bed height, that's not as easy a fix as the other things, but you always want to look to see if you can lower the bed height first. So does the frame that it sits on, can you lower that? Is it an option to actually take the mattress and the box spring off of the bed frame for a little bit to bring it down, or set it on? I had a client whose son set her frame, or not her frame, but her box spring and her mattress on 4x4 deck posts. That made an excellent height.
So took it off the frame and put it on those deck posts.
Right, because sitting that all the way down to the floor, the box spring and the mattress might be a little low. But if not, usually what I will do is I'll recommend a step. Now, people cringe at a step, especially if you've just had a surgery. But I'm not talking about the plastic, 8-inch high, itty-bitty
steps that
step
fold
stools.
up. And those are dangerous.
We are talking about, typically I like to lean toward an aerobic step. It's the nice wide step. It's got a good secure base. It will elevate several levels,
and
usually.
It's rubberized, and so it's non-skid.
It's non-skid. And then to that I will add a bed rail, just for another handhold for trying to maneuver and get in and out of bed. It just makes such a difference. And then along with getting into bed, especially, if you have, and we really like people to be as independent as possible. So I like to throw in a leg lifter, because that will help you assist that surgical leg for a while in and out of the bed, because most likely you're not going to be able to actively lift that on your own. So I throw in a leg lifter. I'm just going to give a little plug here, because I have actually developed a leg lifter. It's called the ProFlex by ViveHealth.com. And the reason being that I'm giving that plug is because I developed it for a specific reason. I like having a leg lift for my clients, especially for total knees. I like a leg lifter for both hips and knees, but with total knees, a lot of times I will use what I have developed to help them exercise it.
Because you got to do those in recovery. A physical therapist will tell you you've got this set of exercises.
Right. And especially getting that knee bent and moving that leg and strengthening it. I've developed it so that it kind of splits apart. It's not just one single piece.
Yeah. So it comes up the side, whereas
Comes
a
up the
regular
sides, yes.
leg lifter is a metal rod.
Yeah.
And it's got two loops on the end. One is a handle, and the other one you use to loop your foot with.
Right.
And so you have to choose one side or the other of your knee.
That's correct.
So when you're using it,
yeah, you could potentially put some torque
yeah,
on your knee.
you can twist
Yeah.
that new knee and
Yeah.
stuff. So
Yeah.
so yours, the one you've developed, the
Right.
ProFlex, goes along. It still loops around the foot,
Yeah.
but it's got the two straps that are rigid
Yeah.
that go along the side of the knee, and that
Right.
way when you're doing what are those exercises
Your
called?
heel slides.
Heel
Yeah,
slides. It's
bending
going to
the
make
knee.
it easier for
Yeah.
you to provide pressure
Right.
or lift
Right.
without twisting
Yeah.
your knee.
Yeah. So that's another addition to
And
what
it
I
helps lift your leg into bed.
Yes, into bed,
Out of bed.
into the car.
Yeah.
It can help lift your leg into the shower, into
Yeah.
a tub shower
Yeah.
if you need it. So yeah, absolutely, It helps in all those areas.
Okay.
Yeah.
Okay, so we talked about the bed, we talked about the bathroom, we talked about the comfy chair.
Yeah.
I would like to talk about a couple of areas that we talk quite a bit about is pain, controlling your pain when you come home
Yep.
from your
Yep.
surgery. Can you
Yep.
talk a little bit about that?
Yeah. So from my experience, and this doesn't happen all the time, but from my experience, a lot of times when you're getting ready to be discharged after your surgery on discharge day, it takes a little bit longer than what you expect. And if you're not paying attention to your pain medication regimen, many times I've had people discharged right at the end of, or close to the end of, their cycle of pain medicine, like meaning they're just about due for new pain medicine,
Right.
and they don't necessarily get that before they leave.
Yeah.
And then a lot of times if the doctor that you're working with is not able to prescribe pain medicine ahead of time that you have at home, they send you with a prescription. So by the time you get home or sit in the line waiting on your prescription and then get home, sometimes you get behind that pain and it gets out of hand.
Yeah, you do not want to you
Right.
don't want that pain to get ahead of you.
Right.
Because it is hard to get back in front of.
So I always tell people to kind of pay attention to that pain regimen. So let's just say, and again, this is just hypothetical, let's say you get your pain medicine at 8 and you're due for it at noon, but you're getting discharged right before noon. Please ask if they can go ahead and give you that dose before you leave.
Yeah.
Just to kind of pad you so that you have some time before it's due again, and you have time to go get that prescription, or have somebody go get the prescription so that you can get settled at home and all that stuff.
Make sure you advocate. If you're the family caregiver, make sure you're advocating for that for your loved one prior to leaving. If you are the care recipient, or if you are the patient, man, you really need to advocate for yourself when it comes to that. In addition to the pain medication, let's kind of talk about controlling pain and therapy.
Yes.
What's a good idea for somebody that has therapy scheduled for their recovery? What's a good time frame for somebody to take maybe medication prior to, so that they can get the full benefits of therapy?
Yeah, you want to try to take it at least a half hour ahead of time, if not an hour ahead of time.
Okay.
And you work with your therapist and kind of get a schedule on when they're going to be coming, and do make sure that you kind of have that on board, so that the therapy goes well and you can get as much as you can out of that. The other thing that I can't stress enough is using ice. Using ice and elevation to help reduce the swelling, because the more swelling you have, the more pain you're going to have, because there's no room for anything to move like it should. Everything gets squished, and
And we have a video for that too.
Yes, we do have a video for that.
About how to elevate the leg, and then we also have another video about
if you're sent home with that circulating
those
ice
polar cubes or whatever they call them. It's got the ice in the bucket, and then it's got some tubes that circulate the cold water, and you wrap it around your leg, and it's always got that ice.
Yeah, so ice and elevation is so important. And then, of course, moving. You have to do your exercises. You have to move, especially on a total knee joint.
Yeah.
That bending and straightening is absolutely crucial.
Yeah.
Yes. You know, a lot of times it's difficult to lay with that leg out straight after surgery, especially if you've had a long history of your hamstrings, you know, being very short because of the knee pain and all of that.
Yeah.
But it's very, very important to try to do the best you can, keep the legs straight when you're you know, laying and resting and elevating, and then constantly throughout the day do little bits and pieces on trying to bend that knee.
Yeah.
You don't have to take it to the max every single time, but it's very important, because what's happening is everything that's been disrupted and cut through is trying to heal and trying to create new tissue. And as that new tissue forms, it kind of just lays down haphazardly. And what you're doing with movement is you are training it to, and telling it what direction it's going to lay and how long it's going to eventually be for you. So through stretching and through movement, that's what you're doing. And if you just let it do what it wants to do, it will set up.
Inertia.
And it's not, you know, and then you'd be amazed at how difficult that is to get corrected. So
interesting. You know, one thing that we didn't touch on as far as the house and getting prepared, and it just popped into my mind, was getting into the house. After surgery. So you get discharged from the hospital, you get in the car, which would be another thing, and, you know, a car, which we did with that woman too. We gave her the car assist handle. It goes in the little latch on the door. It's just a handle that slips in there. It's got a steel piece in there, and then just as a handle where you can actually push off into standing or use it to lower yourself into the car. Because man, when you open that door in a car, if somebody's trying to help you get in, it's minimal space. You know, so you really, some of that, a big chunk of that energy is going to have to come from you. And if you're just after surgery or on pain medication after surgery, it's going to be, you know, it's going to be tough. So the car, and we have a video for that.
And I
want
to
get a video for that.
Add one other thing is when you're getting in the car, doesn't matter which surgery, have your caregiver put that seat all the way back, give you plenty of space to bring your leg in.
And that's when a leg lifter would come in handy as well too. So the car's one thing, and then the other thing, getting into the house, and you might not even recognize that you had steps to get in the house until after surgery. You're like, who put that stair there?
Exactly.
It's on the porch. When did that get there? So maybe briefly talk a little bit about getting into the house after surgery.
You want to just take the path of least resistance doing that. And, you know, you always, the therapist, you're going to be shown how to take stairs before you leave the hospital. You know, you may want to consider making sure that you have a good hand placement, a good handrail, a good grab bar, something like that, depending on how many steps you have, because there are techniques to you know, get up one step, you know, with a walker fairly easily. When you start to have multiple steps, it gets a little bit more difficult.
And fatigue.
So sometimes it's going to depend on, you know, what your weight bearing status is and what your step situation looks like. So you want to be prepared and know where you think you're going to go in prior to leaving the hospital. And you want to talk to your therapist, let them know what your situation is, and try to, you know, rehearse that prior to coming back home.
So the name of the game is be prepared. Proactive.
Yes.
Be proactive as much as you can. And again, so it kind of goes back to the message that we were saying at the beginning, is that I think it's human nature to not
procrastinate.
Yeah, to procrastinate. I think
That's-
it is.
Yes, it
yeah,
is.
I know.
We all do it.
Well, I mean, you know, if you think about it, the anxiety that comes from thinking about it and
Yeah.
preparing ahead, you know,
Yeah.
when it's less anxious, makes you less anxious to not think about it.
Yeah.
You know, and so you put it off.
Yeah.
You know, and then at some point you're going to have to think about it, and then it's
Right.
too late. So being prepared,
Yeah.
you know, is really the name of the game when it comes to any kind of joint, well, any surgery.
Yeah.
You know.
Yeah.
So
And-
that's kind of what we wanted to hop on here and tell you guys about today. Talking about getting ready for joint replacement,
Yep.
knee and hip replacement in particular.
Can I add one more
You
thing?
sure can.
Because I'm the
Please
queen
do.
of one more
well,
thing.
you are the queen of
I
one more
always tell
thing, and
people
you're a
that.
physical therapist, so we want to know what you have to say.
You know, sometimes, well, more than what I like to see,
Yeah.
throughout my career, there have been people who've had the replacements that have had to come home on their own.
Yeah.
And just some of the other things you need to think about in preparation is having a couple of weeks, because it's going to be, you usually go back to see the doctor in about 2 weeks after surgery.
Okay.
And you want to be prepared with things like extra toilet paper.
Yeah.
And, you know, if you have a pet, how are you going to feed the pets?
Yeah.
If you,
The mail.
Yeah. Set up with the mail
postal
person
service,
to
yeah.
try to get that mail. If your mailbox is out by the road, see what you can do about getting it up to your door.
Yeah,
or
even just for that, you know, even just for that first few
Right,
weeks.
right. And think about preparing some meals ahead of time and
Oh,
putting
that's a
them in
good
the
idea.
freezer or
Yeah.
something, getting something that you can do very easily.
Mm-hmm.
Just, you know, trying to be prepared in that aspect too.
Yeah, I love it. Again, prepare.
That's right.
What is it? Who is it? The Boy Scouts? Be prepared?
Be prepared.
Is
I
that
don't know.
the
Is
thing?
that?
I don't
I'm
know.
not sure.
If you got any Boy Scouts out there,
Let
or
us
Eagle
know.
Scouts,
Yeah.
leave us a comment and let us know. So, all right. So before we leave, we wanted to tell you that Cindy and I are a part of. We're going to have some other social media people are going on a cruise, and
Yes.
we're calling the cruise. It's called Self Care at Sea. So it's geared towards caregivers, family caregivers, and giving them a chance, a little bit of respite. It's a 7-day cruise.
Yes. 7
Well,
day
with,
or 7-night cruise with Norwegian.
Norwegian.
It's on a new ship. I think it's called
the
Norwegian Aqua.
Yeah,
And it's going to be October 19th through the 26th.
of this year.
Yes, of this year. We're going to put a link for details
We've got
on that.
more information. We got a website that's got more information about it, where you can learn more, or you could sign up.
Right.
So we'll put a link in the description below this video. You know, and I think each host, we have about 5 hosts
Yeah.
that we're doing this with, and so you know, each host is going to be doing hosting
Right.
an excursion on the trip. But you don't have to do the excursion if you
Right.
don't want to. If you want to just come and get you a little drinky poo and put it in your hand and lay in the deck chairs the whole time, then that's all you, because this is about caring for the caregiver and
right.
making sure, you know, that you guys are getting the rest that you
Yeah.
need, even if it's just for a few days. So
That's very true. And one other thing.
Yeah.
One more.
I know you're the queen of one more.
We're coming, if you're in the Chicago area,
Oh, yeah.
come and visit us.
Yeah.
The Billy's Expo.
Chicago Abilities Expo. It's in Schaumburg, actually.
Yes.
And that is in June.
Yes, it's June, 22nd?
Yeah, I think so,
I think
22nd.
some right in there.
That weekend.
Yeah, I
It's
should know those
Thursday, it's
dates.
Friday, Saturday, Sunday. So
Yeah.
we will be there. We'll have our AE Corner Superstore and
Yeah.
our boutique, and we'll have lots of sponsors that are going to have their products there. So we'll be demonstrating stuff. If you're in the Chicago area, we would love for you to come by and say hi.
Yeah.
That would just, we love meeting people in real life instead of just on the internet. It's always fun to meet people in real life. So come by for that. I think we're at booth. We moved. We
Yes.
we are now, I think, at booth
1001.
1001. So kind of got a big booth. So come by and say hi to us. So anything else?
I think that's it.
Queen of one more thing.
Yeah, I think that's it.
All right, very good. All right. Well, we appreciate you guys spending some time with us. We hope you find this information helpful. If you wouldn't mind giving us a follow, a like, sharing this with somebody that you think might benefit from it, we greatly appreciate it. So until we see you in the next video, have a great day.